Hello and welcome everybody. I'm your host Morgan Epika Izol Kama Jr. And today I'm going to take you in surgery where I will be looking at the complication of the head injury. Okay, so we'll start with the spinal cord injury. So under spinal cord injury here, we'll start by defining what's the spinal cord injury. Of course, when you hear the word like as in spinal cord injury, of course, there is something that will pop up in your mind to say it is maybe an injury of the spine. Okay, so now spinal cord injury usually refers to an injury of the spinal cord that is caused by trauma instead of disease. So it is an injury that is caused by trauma. Sometimes trauma usually comes as a result of maybe accidents, or maybe there is an external object that has just hit a person to an event that it has even damaged some of the spinal cord. So it has damaged the spinal cord. Those trauma as well as the bleeding that will start up, that is what we call the spinal cord injury. This is an injury that is done in an absence of a disease. So instead of a disease, but it is just an injury that is done maybe through trauma, which is just the absence of a disease, through maybe accidents and whatnot. Yes. So spinal cord injury, sometimes it depends on where the spinal cord as well as the nerve roots. So you need to understand that on our spinal cord, we have what we call the nerve roots. So starting from the neck here, we have what we call the cranial nerves, like the cranial roots, starting from C1, C2 up to C5, somewhere there, yes. So these are the nerve roots that we need to take into consideration. So when a person has got the spinal cord injury, it simply means that maybe one of these nerve roots are damaged. So the symptoms can vary widely. So sometimes the symptoms can vary, and when we say the symptoms can vary, what we are trying to talk about is that the symptoms will manifest differently. Maybe if someone has got the spinal cord injury on the cranial roots, or rather the thoracic roots, you realize to say that maybe part of the limb, either the upper limb or the lower limb, will not be functioning. And we all know that what really controls our limb, our upper limb necessarily per se, it is the brachial plexus that is emanated from the cranial roots of the nerves through the brachial plexus. Okay, now okay, so pain from paralysis as well as incontinence. Okay, so in here, this is where you find to say that when these uh, nerve roots are maybe disturbed, there would be pain to paralysis. Sometimes when you disturb, let's say when you disturb your muscocutaneous nerve, the one that is emanating from the brachial plexus, usually makes your brachial, which is your arm, to feel numb, and that one on its own, usually call it as in just the Saturday pulse. Okay, then what would be the treatment of the spinal cord injury? How can you treat the spinal cord injury? Number one, you must start with the restraining. So we need to start with the restraining of the spinal cord. You need to ensure to say that there is a restraining of the spinal cord, as well as there is also controlling of inflammation. Now, how is this inflammation comes in? Remember when there was trauma, meaning that there was an accident, and then meaning to say that this spinal cord, it was moved from its position, and then the fluid moved from to the extracellular matrix, from the intracellular into the extracellular, causing what we call an inflammation where there was a swelling. Okay, so for you to control or to prevent inflammation, to prevent this spinal cord injury, or to treat this spinal cord injury, you need to ensure that number one, you restrain the spine. Number two, you control inflammation to prevent further damage. Again, the actual treatment can vary widely. Yes, The actual treatment, yes, it can vary widely depending on the location and the extent of the injury. Is the injury the first degree or second or rather third? Is it severe, or maybe it is just a minor injury, or is it just a moderate injury and whatnot? So when you look at the kind of an injury it is, that is how even the treatment will vary. If the injury is severe, meaning that even the treatment maybe will last maybe for a longer period of time. But if the injury is it is just mild or rather just minor, or maybe it is just on just a minor injury, it will be treated very fast and effective. Yes. So in many cases, the spinal cord injury requires what we call substantial physical therapy. So there ought to be substantial physical therapy. Why is this substantial physical therapy is important? Because number one, you need to understand that this injury, it came as a result of what? Trauma. There was no infection from the pathogen, no infection from any bacteria, no infection from any disease causing organism, but it came as a result of trauma. Maybe it was an accident, or maybe it was yeah, it was an accident, and so on. Yes. So if you want to like as in to treat this one, usually comes with many cases where we look at the spinal cord injury, which just requires physical therapy as well as rehabilitation, especially if the patient injury interferes with the activity of daily lives. Now, when you look at this part here, you're going to agree with me that mostly when a patient just walk into the either the clinic or at the hospital, it is very much important as you are doing your history taking to ask that your patient, maybe we have what we call uh, those social history when you're taking history taking and whatnot. It's important to know where it's very much important to know where your patient or your client, before any person becomes your client, before any person becomes your patient, they are usually our clients. So it's very much important to know where your client occupation is, what they do, maybe if they are working at the industry or maybe at the construction company. You might find out to say that that's where maybe the problem came from. That has to do with trauma. Okay, because all this usually interferes with activities that is done in the daily lives. Okay, now what would be some of the causes of the spinal cord injury? So the number one cause of the spinal cord injury, number one, is that they usually have many causes, but typically it is associated with, I'll just give you two which are very much essential. Number one, we have what we call the major trauma from motor vehicle accident. So when we talk about major trauma, these are injuries that affect the body on the higher degree. These are injuries that should affect the body on a higher rate or rather higher degree. It can either as a result of maybe a person was bashed by a car. That would be the major cause of trauma. Yes, so that one we can even refer to it as in it's the major trauma, meaning that it is coming from a person who was bashed by a car. Okay, or maybe a person falls. Maybe they were constructing an upstairs and then that person fall down. So when a person fall down and injure themselves, that one also can also be considered as in the trauma. And that's the reason why sometimes it's very much important to go and visit the site where the incident occur, either the accident or the incident usually occur, so that you understand how deep the injury is. Yes. Then besides that, there is also sports. Maybe person was doing some sports and then this person has been injured, or maybe it can either be from violence. Maybe when people are doing some violence, there is some conflict, misunderstanding, and then someone has been injured. Maybe remember those. There are other violence where people usually use sharp tools to try to defeat each other and whatnot. Yes, so that's the first thing. So here you need to take into consideration that the major cause of spinal cord injury, number one, it's just the major trauma that has to do with the motor vehicle accident, falls, sports injury, as well as violence. Number two, it has to do with the most traumatic spine. The most traumatic spinal cord injuries are caused by uh, the lateral bending. No, lateral bending. We have what we call these anatomical terms. Remember the question that you asked? I got something from your voice note when you told me to say there are lecturers that you explain or describe things in the way they want, not necessarily per se, but just like I answered in the voice note that I had recorded, surgery as well as medicine, these two courses, if you want to the med surg, if you want to be good at it, your foundation, your anatomy and physiology foundation, it has to be excellent. Yes. So initially, when you come across a question where you feel like, no, this one will tell you you should write this and whatnot, initially what they are just trying to tell you is that they just don't want to tell you to say you need to refer back to the anatomy and physiology that you did, because mostly, believe you me, what will happen is that when you're in second year, a lot of people, they don't even tend to go back and check the anatomy and physiology through their book. But most of these conditions that you are learning, they are taking you back from this very anatomy and physiology that you did. So like here, we have what we call the second cause of spinal cord injury. We are saying that they are caused by the lateral bending. Now, lateral, it is anatomical term. So lateral, when something it is lateral, remember we have what we call lateral as well as medial. We have what we call proximal, distal. We have flexion, extension. We have abduction, adduction, as well as circumduction. So all those things, supination and pronation. So all those things, you need to ensure that you remember them, because when you know to say, okay, so under this one, we are saying the other cause is bilateral bending. Okay, that is the other cause. When lateral bending, when a person is bending laterally, you can make your vertebral column to become dislocated. If let's say you didn't bend well, the time that you were trying to bend laterally, yes, then the other cause is dislocation. Yeah, dislocation as you are bending, or maybe you're trying to through rotation. You agree with me that mostly sometimes a person can tell you to say, no, I can't rotate my neck. I can't rotate my neck. Why? Then they'll tell you to say, no, it's like I slept on the other side. Sometimes when you sleep on the other side, when you wake up the following day, what usually happens is that the time that you're trying to rotate your neck, you feel the neck could be so painful. Why? Because you rotated your neck to the max. Remember, the neck has got the muscle which we call the sternocleidomastoid muscle. This sternocleidomastoid muscle, it is the muscle that usually makes your neck to rotate, either to rotate on the left side as well as on the right side. And you need to understand that according to the anatomy and physiology of muscles, we have three major types of muscle. The first one, it is the skeletal muscle. These are muscles that are found on the skeleton. The second one, it is the smooth muscle. These are muscles that are found in blood as well as in the alimentary canal. Then the third one, we have the cardiac muscle. These are muscles of the heart. Yes. So now, if a person tells you to say, no, I'm feeling my neck is paining, I can't rotate my neck, that person had to make the sternocleidomastoid muscle, which is falling under the skeletal muscle, to become what we call to become contracted without relaxing. Remember, the function of the muscle is to relax and to contract and relax. You cannot contract a muscle for a longer period of time. When you contract a muscle for a longer period of time, guess what will happen? You have what we call muscle twitch. What is a muscle twitch? A muscle twitch, it is a kind of pain that you tend to receive from your muscle because you had made the muscle to be contracted. How? Maybe you slept on the other side, you didn't turn, and that's the reason why you're experiencing pain from the neck. That usually happens. So sometimes sleeping like that, and that's the reason why when a person is sleeping, it's always very much important to have a pillow where you can put your neck. Otherwise, you hear a lot of people complain about pain, they can't rotate their neck and whatnot. Yes. Then again, we also have what we call the axial loading as well as hyperflexion. Now, when we talk about hyperflexion, the word hyper means high, it means increase, it just means high. So hyperflexion, this is where when a person is just flexing their limbs, maybe through excitement, because for someone to be under hyperflexion, it is a result of what? Excitements. Have you ever seen those people that usually do back summers and whatnot? Yes. When a person is excited, they do the back summers. Guess what will happen? Maybe if the back summer didn't go well, what happened? They will injure themselves, and that injury is just as a result of what? Hyperflexion or maybe hyperextension. So hyperflexion is when someone flex. How can you flex? You can flex backward. That is the back summers. Then hyperextension, you can extend friction, you can extend forward, then extension you can extend backwards. Yes, so extension you extend forward, then friction it's backward. Yes, so friction you go backward, hyperfriction you go backward, like you flip backward. So those people that flip backwards, they usually have what we call that spinal cord injury that they usually have. It's as a result of hyperfriction. And those people that usually have spinal cord injury due to flipping forward and then they didn't flip well, it is as a result of they had flipped through what we call hyperextension of the cord, which is also called as in the cauda equina. Yes. Okay. Now, quickly let's just get into the classification of spinal cord injury. What are some of the major classification of spinal cord injury? Number one, we usually classify spinal cord injury based on the neurological response. Now, when we say neural response, we are referring to the nervous system. Remember, this nervous system, it is not something that is complicated, or maybe something that we've not heard about, but it is something that you had learned in anatomy and physiology, because there is that course which is that topic that is called uh, the anatomy and physiology of the central nervous system. Okay, so when we say neurological response, we are referring to how the nerves, the neuron, are responding. Remember, the pathway for these neurons, we have what we call the receptor cells. So our body, it has what we call the skin. And remember, the skin is one of these systems, the 11 system that usually makes up an organism, which is the integumentary system. Now, when you look at the skin itself, it has got receptor cells. It has receptor cells all over. What are these receptor cells? Receptor cells, these are cells that sense a stimuli. Receptor cells, these are cells that sense and detect a stimuli. What is a stimuli? A stimuli is anything that elicites a response. What is a stimuli? I repeat, a stimuli is anything that elicites a response. Okay, so in here, under the neurological response, we have the stimulus of what? Touch. If let's say something is, let's say a person is touching you, you'll be able to feel what makes you to feel that there is someone who is touching me. It is as a result of these receptor cells that are found on our skin. Not only that, if a person is pinpricking you, like for example, if they want to get some blood, maybe they want to do the malaria test and whatnot, they'll pinprick you. You'll be able to sense and get the sensation test of each dermatome. Remember, these dermatomes, they are all everything that I'm explaining on this one. It is just taking us back to anatomy and physiology, just to answer that question you had asked me to say, no, these lecturers they'll tell you this and what. So anatomy and physiology is the foundation of medicine as well as surgery. If you want to be good at it, that anatomy and physiology, it has to be, you need to build a strong foundation of anatomy. And that's the reason why before you were introduced to medicine or surgery, they had to make you learn anatomy and physiology the whole year to prepare you to lay on a foundation so that when they start bringing you cases, you'll be able to relate. Because if you don't know what is normal, if you've never seen a normal thing, you cannot tell anything that is abnormal, because you'll be like, even something that is abnormal, you will also refer to it as it is normal, because you never understood what a normal thing is. And that's the reason why it's very much important for us to understand the normal body structures, organs, as well as systems, so that will help us to ascertain any abnormality or any disorder that we are going to encounter. All right, okay, so let's continue. So the dermatome, through the key 10 through the strength of the 10 key muscles of each side of the body, including the hip flexion. So we also have what we call, remember, we have this one, which is lumbar 2. So on lumbar 2, remember, on the cords, these spinal vertebral cords, these vertebrae, they usually start from the cranial, the C1, they go to the thoracic, which is the T1, they go to the lumbar. Now on the lumbar, here we are referring to L2. So L2, that is the lumbar 2 vertebra, where the what is the hip flexion, usually A, where the hip flexion is done, and then from there we usually get to have what we call the shoulder uh, shrunk at C4. So that's at the shoulder, which is at the cranial nerve 4. Okay, then the cranial vertebra, the cervical vertebra 4. So cervical, it's the cervical vertebra, sorry, not cranial. So cervical vertebra, these are vertebrae that are found on the neck. The other name, the other words that we can use in anatomy to replace the neck, it is cervical or cervix. So anytime when you hear the word cervix or cervical, they are just talking about the neck of something. Yes, all right, okay. Then the elbow friction. Remember, elbow friction. It is as a result of what? A distraction, or maybe of when this cervical vertebra 5, it has been distracted, or maybe there is an injury, a person will fail to do what we call elbow flexion. And then again, we have what we call wrist extension. So wrist extension also, it is done When a person has got an injury on the cervical vertebral 6, a person will have difficulties in extending the wrist. So wrist extension becomes impossible when your cervical vertebral 6 has been injured, and the elbow extension becomes impossible. It becomes difficult when your cervical vertebra from root number 7 has been injured. So traumatic spinal cord injuries are classified into 5 categories on the ASIA impairment scale. Okay, so for now I'm going to introduce you into what we call the ASIA impairment scale. Okay, so what is the ASIA impairment scale? Okay, so the ASIA impairment scale usually starts with A, B, C, D, E. So A, it indicates to say indicatesa. So indicatesa, that is A. So under indicatesa, we have what we call a complete spinal cord injury. So we are having a complete spinal cord injury where no motor or sensory function is preserved. Okay, where no motor as well as the sensory, where there is no motor or sensory function which is preserved in the sacral segment. Now remember, the sacral segment, it is found inferior. Now I'm using anatomical language here. When I say inferior, I'm referring to something that is below. So when we look at the lumbar is superior to the sacral. So when we talk about the sacral segment, which is S4 and S5. So S4 and S5, they are inferior to the lumbar vertebra. So in an event where a person is having what we call A, the first one, which is the A, indicatesa, which is just a complete spinal cord injury, where when we say no motor or sensory function, a sensory function, it is these we are referring to the nerves that usually sends an impulse from the receptor cells. And then when we talk about the motor sensory, the motor neurons, we are referring to the neuron that usually gives a feedback for you to put up a reaction and withdraw from the pain.